Broadcast is now starting. All attendees are in listen-only mode.
Good morning or good afternoon, I guess, depending upon where you're listening in from. My name is Renee Jeffries Heil. I am the chair of the Exercises Medicine On Campus Committee. And if you guys are in the right place, you guys are here to listen and learn a little bit more about the registration and recognition process for Exercises Medicine on campus programs. The goal of this webinar is really to provide you guys the big changes that we've made, a little bit from over the last 2 years, but definitely the changes that were made from last year until this year. The goal of the changes were to streamline the process, making it easier for you guys to apply, but also easier for us to evaluate, and a little bit more quantitative evaluation process. I am going to go through the slide set that we have and bring you guys up to speed on some information. If you have questions, and that's really the goal of this webinar, is to provide you an opportunity to ask those questions. I'll be on at the end, Shelby will be here, and then Karina Winters will be joining us at some point as well to see if we can answer any questions that you have so that you can submit your registration and recognition application seamlessly without any issues. So if you have questions, there's a little chat bar at the right of your screen. Type them in there. Shelby's going to be looking at all of those and then help to moderate that question period at the end. So with that, I think we will get started. So basically, we're going to briefly review how you can get involved with Exercises Medicine on campus, the renewal and the registration renewal process, some of the changes, some of the benefits, the recognition process, some of our updates. I'm going to go over the review of the levels of different that you can apply for, because I think that that's important with the new recognition process, and then leave, as I said, time at the end for you guys to answer any questions that you might have. So for those of you who do not know me, I am a master's trained clinical exercise physiologist with a Ph.D. in epidemiology. I have had, over the last 25 years, most of my experience has been in the clinical setting, working both for myself as an independent exercise physiologist, but also as part of a hospital system, and then finally as part of a university. I'm currently doing some consulting, independent consulting, and I'm not affiliated with the university, but I still have my hand in a fair amount of research that's associated with Exercises Medicine on campus, and really looking at the implementation side of things. So I am going to make the big assumption that everyone on this call understands what Exercises Medicine is, what Exercises Medicine is, and what the initiative is. But that concept was created by Bob Salas while he was president of ACSM. He initiated this program, and it's basically designed so that healthcare providers start to have a conversation with their patients about exercise during each and every visit. So exercise becomes that vital sign. And so that's the core component of the Exercises Medicine initiative. In order to achieve that, obviously there's other activities that are going on, everything from working to include the concept of exercise and Exercises Medicine into medical school curriculum, working within large healthcare systems, working on education, improving the education and credentialing for health and fitness professionals. There's a whole lot of things going on. Exercises Medicine on campus just being one of them. So what we realized, what Karina and Bob realized early on, was the fact that we're this microcosm on campus. And so we have the ability to implement Exercises Medicine relatively easily when you compare it to a large hospital system on our campus system. And that's where Exercises Medicine on campus was born. So we are so much more than just that referral process. And over the last 10 years, that's really what has come about, is that Exercises Medicine on campus has taken lots of different directions based on university size, based on desires at the university, based on individual university needs, and has really expanded from there. And this registration and recognition process is really designed for us to be able to highlight the things that you guys have done, but also capture some information on what all the wonderful things are that are going on the various campuses. Right now, there's over 270 registered campuses around the world. Our international campuses are increasing as we speak, not to mention the huge growth that we're seeing in registered and recognized campuses here in the United States. So if you've been doing exercises medicine for a really long period of time, one of the big changes is that we used to have a registration period. Right now you can register at any point throughout the year. But what we are requiring now, which is a little bit different, is that you renew annually. What we were realizing is that because there tends to be some change that happens on campuses, that we didn't always have the right contact information for schools, and so we just want to update everyone's contact information and information about their school and the program, that the Exercises Medicine on Campus program they are running annually, and that's built into the recognition process. Okay, so you can renew and apply for recognition at the same time. If you happen to be on this call and you have never applied for registration, there is no deadline. Register whenever you get your leadership team pulled together, and then we'll move you through the process from that at that point. So if you look at some of our registration statistics, this is the number of schools that has grown each year, the number of schools that we've added. So we keep adding schools every year in a huge volume, which is part of the reason for the need for a streamlined registration and recognition process. If you were just starting a program, go to the exercisesmedicine.org web page, look at On Campus, click to see if there's an Exercises Medicine on Campus program already at your campus, and then you're going to go through and develop your leadership team. Part of the reason I want to point that out during this process is that we review every single application that comes in. And though we would expect from a large institution that has multiple locations, for example, a Penn State, to have applications coming in from every satellite, what has happened in the past is that we may get 2 applications from the same institution that is not aware that there are 2 programs being run on campus. So if that happens, we're going to come back to you guys and say, okay, wait a minute, you guys are going to need to look at this, because what we're looking for is to have one single point of contact and one single leadership team. So this is an opportunity for that fabulous cross-campus collaboration and to connect you guys with the other folks on campus that are doing exercises medicine if that happens. So that's part of the reason why we want you to just double check if you do not know. We want you to register your campus, whether or not you apply for recognition. And there's a couple of reasons. One, we're here to support you. And if we don't know you exist, we can't support you. These webinars are designed specifically to provide the information that you need as a campus to implement or to grow your Exercises Medicine on Campus program. But like I said, if we don't know that you're there, we don't know what sort of help to provide. You also get a custom Exercises Medicine on Campus logo. There's increased networking opportunities if you register your campus, and there's also access to these webinars. Right now, we are looking to find, and this is something you guys have been asking for a long period of time, and so we're really working hard on this, is to find funding opportunities for on-campus programs. But our funders are looking for information on how many schools do you have that are registered? What types of schools are they? Are they large? Are they small? Are they private? Are they public? And that is some of the information that you're going to see as part of that registration process, because that's information that we need to know so that we can go out to some of these funding institutions and say, hey, look, this is the demographic of the people that we serve, and here's why it is so important for you to give us money to support them. If you are someone that's on this call that is brand new to the registration and the recognition process, and you're just looking to find some information out about Exercises Medicine on Campus in general, there's a link at the bottom of this this page in the presentation, which is attached as a PDF to this GoToMeeting, and it's a link to a webinar that we've done that takes you through how to create an exercises medicine on campus leadership team and sort of how to launch the program at your school. Look at that webinar. If you have questions after that, contact myself or Shelby. We will put you in touch. We will either answer your questions if we can, or put you in touch with a school that has similar demographics to yours, so that you can talk with another program about what they've done. So I want to briefly review who we're looking for on your leadership team, because we are looking for contact information on each of these individuals. We need an advisor, we need a healthcare professional, sometimes those are, we need a health and fitness professional, sometimes the advisor is also a healthcare professional. There is an ability to sort of overlap there, and that's all right with us, but we do need full contact information for everyone. We ran into an issue where if someone leaves the institution, which sometimes happens in higher ed, we then don't have a way to contact anyone to see if the exercises medicine on campus program is still continuing. So that's the big reason why we want to have full contact information for the entire leadership team. We're also, as you know, we really want to engage students in this process, and that's the reason why we have these student representatives on the leadership team. This is also part of the reason why we want to update this information annually. Students are often the quickest to sort of rotate off this leadership team and a new set to rotate in. So we want to make sure that we have the right information for everyone. So yeah, we'll need contact information for everyone on that. On the recognition process, so we have the registration process, which gives you the logo, gives you some additional support, provides us some information on those individuals that are doing exercises medicine on campus. The recognition process is really the opportunity to highlight what you have been doing, right? So we can highlight it as an organization. We do a big event at the national meeting on Wednesday night where we call up the schools, we have a photographer, there's an opportunity for schools to then take those professional pictures, do press releases. This is an opportunity for you to go back to your institution and say, hey, look, what I am doing is of value, and look at the awards that we have won because of it. To make the recognition process easier, you can download the application prior to filling it out. So it is an online application that you need to fill out to apply for recognition. You can download that first to make sure that you have all the information before you go to enter it all in. We know that that was a little frustrating for some last year. We also have a checklist to help guide your leadership team on what information you're going to need to pull together when you start this application and complete this application. We're asking, another thing that we're asking for this year, which really dovetails with our desire to be able to provide funding, is we're asking for documentation of the activities that you're performing at the various different levels. So almost always a school that receives gold level recognition, as part of that, are also doing bronze and silver level activities. We don't need to necessarily know all of your activities, but we would like to have documentation of what you think was sort of the best activity that you did during the year that met that level. This helps us sometimes when we have schools that don't think, for example, they're silver level school, but they attach their documentation and it is silver level activities. We want to be able to provide you that level of recognition. The same is true as that if you think you maybe are silver, but you definitely know that you're bronze, submit them both, and then we can make the determination of where you're at. Realize that our goal is wherever you start to be able to help you progress as far as your school wants to go through our recognition process. Part of this recognition process too, we have 270 schools that are registered. We recognized last year 139 at the national meeting. We're expecting that number to be a lot larger this year. So there is a quantitative scoring system that goes into evaluating your application that allows it to be streamlined once it's been reviewed by members of the committee for final award of whichever level that is. So like I said, last year there was 127 national schools and 12 international schools that were recognized. We are recognizing small steps, large steps, all of the work that you guys are doing that you maybe don't feel is necessarily recognized on your campus immediately. This is what we're recognizing at the national meeting. Applications are due February 15th. We cannot accept applications after that fact. One, due to the volume of schools that we have applying. The other is the fact that we need to be able to go through those applications, turn them around quickly, so that if your school does get recognized, you can still take advantage of some of the early bird pricing for the national meeting, and also start to make your travel plans earlier. San Francisco is going to be an amazing conference. There's going to be so much great information, but depending upon where you're at on the planet, it may be a little more expensive to get there. For me in Southwest Florida, I'm pretty much going almost as far across the country as I can go. So the earlier that you have to be able to plan for that, the better. So that's why we need to have those applications in by the 15th, and we cannot accept them after the deadline. So this is just one of the pictures of many that we did at the national meeting. You get to have your picture taken with Dr. Bob Salas. You get to have your picture taken with me. We get to celebrate you, and we get to acknowledge all the work that you've done over the course of the year. So I encourage you all to apply for recognition. Briefly below, you're going to see exactly what goes into achieving recognition at the various different levels. So we're going to go into these in a little bit more detail. At the bronze level, I would assume that most schools are doing some level of bronze level activity on campus. It's something that you are doing that's promoting physical activity on your campus, whether it be, it could be a proclamation, it could be an activity for Exercises Medicine on Campus Month, it could be an activity like a health fair or a 5K that's promoting physical activity to your students, your faculty, your staff, your community. Almost everyone is doing this, and it's real easy to document and apply for bronze level and receive that recognition at the national meeting. Here's just a few of the types of things that some of our schools are doing. This is not an exhaustive list. You can, if you're doing something that's slightly different, pull together the documentation, attach it to your application, but these are just some ideas of some of the things that go into that physical activity awareness and promotion category. At the silver level, we're looking for schools to not only do awareness and promotion, but also start to integrate it into the educational curriculum. Whether that be a lecture series, it doesn't have to be a formal component of the curriculum, or ideally it would be part of the exercise science, kinesiology curriculum. A lot of faculty are integrating it into service learning and experiential learning as part of their curriculum, and has found it to be a really great way to engage students and really further their application of the knowledge that they learn within the classroom. So this might be workshops and seminars for exercise science and kinesiology students, but it may also include seminars that are targeting larger allied health professions, larger healthcare professions, and also the larger campus community. This is definitely working with academic departments to build real content and knowledge transfer. So at the gold level, right, we all want to shoot for gold. This is the highest level of recognition that you can receive currently from the Exercises Medicine on Campus Committee. You have not only done activities at the bronze and silver level, but you've also now implemented the referral program. Ideally, that referral program will be part of your electronic medical records through your student health services, but we acknowledge that not all campuses have that ability. Some of them, it's a paper-based referral system. We are looking to quantify how you are working your referral system, because we are going to challenge you to quantify how many people are going through your referral system and how impactful it is. So for those of you that are not aware of what the physical activity vital sign that we're looking for you to integrate, it is these 2 questions that simply total together to find out whether or not an individual is meeting the minimum level of recommended physical activity daily or weekly. So again, this can be referrals from the physicians, it can be the nurse practitioners, it can be the counseling center, but that they are assessing physical activity as a vital sign, ideally through their electronic medical record. But if it's through a paper-based process, that's fine too. We just want to be able to see documentation in order to be able to award you gold level status. So here's what the breakdown looked like in 2019. We had 28 bronze schools, 56 silver schools, and 55 gold schools. And if you look at that large picture, that is just a small piece of the people that were involved in those campuses at making that, making their Exercises Medicine on Campus program a reality. So we recognized 139 schools. That's a lot. As I mentioned, we are working with Schools International. If we happen to have any international schools on the call, there is an international webinar designed specifically for international schools January 30th, and be sure to let us know and we can make sure that you have that information so you can join. There are national centers in 37 countries, and so we want to support what countries are doing, not necessarily replace what they're doing. So look at us as an additional source of support, but we would like for all of our international schools to also apply for at least registration so that we know that you exist and that we can help you with any information that you need. For those of you that don't know, a great resource that you may need during this process or as you start to expand your Exercises Medicine on Campus program is we just updated recently the Exercises Medicine on Campus Action Guide. You can get at that through the exercisesmedicine.org website, but that's a great resource if you're not aware of it, and it's recently been updated. So here's some other links, and all of these are in the PDF, as I mentioned before. It's the registration form, the recognition form, the Exercises Medicine on Campus, or the exercisesmedicine.org website, where there's a ton of information. Dig through there. There's links to our webinars off the On Campus page. So if you are interested in registering your campus, if you are looking to apply for recognition, if you have questions, you can email Shelby. She's our Exercises Medicine program manager. Her email address is there. You can also email me as well, and I'm happy to answer any of your questions. My email is on the first page. And so I think at this point, I've probably talked everything that I can think of that I wanted to make sure you guys had, and I want to turn it over to you to be able to ask some questions.
Great. Thank you so much, Renee. We actually do have one question already, so we can start with that. She was wondering if it's possible to register for her campus in the next week or so and then apply for recognition before February 15th.
The way that, Shelby, I think this is a you question, is the way that the application is set up that they have to do the entire thing at once?
So this is for, she's asking for a campus, I think, that is not already registered. And so she would be able to register your campus, and then that would be, that application is on exercisesmedicine.org, that website. And then once that happens, then you would be able to apply for recognition. Because recognition, we award activities that are done from February 15th of the previous year, so 2019, to February 15th of 2020.
Okay, so there's the specific question. So if you were just registering, if you've been doing Exercises Medicine on Campus activities, I think the answer is the fact that yes, register now through the link that's on the web page, so that you're there, and then make sure you apply for recognition via the link that's embedded in this presentation, as well as being on our webpage. So other questions?
Not yet. Let's see.
Surely people have some questions about, or maybe we did a good job. We really did. Shelby did a great job this year at going through and capturing every comment that we received from people about the application process so that we could, in theory, make it easier, more user-friendly for you to apply, make it clearer on what you need to use and attach as documentation. So hopefully that is the case. If it is not the case, if you get through the process and you apply for recognition and you're like, it would have been really great if, please shoot one of us an email. We never planned for this process to be stagnant and completed once it's done. We'll aggregate all that information and then over the summer take that information and look to make next year's process even smoother. So if you do have comments or questions, make sure you share those with us.
Perfect. We do have another question here from Deborah Stroini. It says, we are working with the Recreation Center that is partially owned by our university to set up a referral program with local physicians. They would then come to that center and work with the team there. Would that count as gold, or does it have to only be Campus Health Center?
So I'm assuming that you're doing that because you do not have a campus health center on campus.
That's kind of what it sounds like to me.
Yeah, that's what it sounds like to me too. And yes, if you do not have, yes, that would count as if the referral system is set up and the physicians are tracking the physical activity as a vital sign as part of their visits, and then from that referring to your campus, and that's where they're doing the exercise. Yes, that would apply as a gold level activity.
Mm-hmm.
But the key there would be to document what the physicians, whatever the physician, whether it's physicians or nurse practitioners or healthcare professional, is doing to document their physical activity level at their site, even though that site is not on campus.
Right. Great. This is a great question from Michael. He asked, how do you maintain recognition each year? So I do get questions about that, about, I've got gold last year. Do I need to reapply for recognition this year? Do you want to speak to that?
Yeah, and so ideally we would like you to reapply every year because almost no one keeps their program stagnant. Right there, everybody's always looking to improve and to do different things. We think in terms of a year. So if you want to be, every time you apply for recognition, you get to come up on stage, get your picture taken, you get to get your certificate, and you get to be able to promote that within your campus. So we would like you to re-register annually and apply for recognition annually. If it's something where I know that sometimes, and this has come up, especially with the annual meeting being in San Francisco this year and that being rather pricey for some individuals on the East Coast, if you can't make it, it's not like your gold recognition status from 2009 goes away, if that makes sense. But right now, we're not sort of rolling schools over. If you got recognition in 2019, it's not like you automatically get recognition in 2020. Why?
Mm-hmm. Yeah, so you will need to reapply.
Yeah, I think, you will need to reapply. That is something that maybe we need to think about moving forward. But right now, because we're looking to collect that data for these individuals that are looking to fund the exercises medicine on campus, either research or program startup, we need to be able to quantify how many people are participating. So I'm really encouraging everyone to, at a minimum, register and definitely apply for recognition. If you can't, here's a question that I would expect to come out of my what I just said. What happens if you make it to the annual meeting? Right. Well, you can obviously, if you're the advisor or the lead on this program, if you can't make it, you can send someone in your place. Someone else will be there. If not, we will mail you your award. You won't get your picture taken because you won't be there, but we will mail you your award so that you have that after the meeting.
Great. couple more questions here, which is great. Keep them coming. We have, for silver level, would an exercise science club talking to the campus count for the education component or qualify them for silver level?
Yes. Yeah, it doesn't have to be, it does not, so yes, so if you're conducting a campus or community educational seminars on physical activity and you're talking about exercises medicine, whether it's students that are talking about it or faculty that are talking about it or health professionals that are talking about it, if you have a really engaged student health center and they want to talk about it, it doesn't matter to us who's talking about it, but what matters is the fact that you're conducting these sort of community, either being campus community or larger community educational seminars. And if the student club is doing that, that's silver level activity.
Perfect. Regarding the referral process, Erica asked, can a referral come from counseling services or should it only come from the campus health center? Which I think you might have discussed, but maybe just.
Yeah, and that's a question that we get a lot, so I'm glad that Erica brought that up just for clarification. Yes, you can get referrals from counseling and psychological services, whatever the name is on your college campus, to your exercises medicine on campus program, and that counts as a referral, yes. Because it's a healthcare professional that's talking about it. But again, you're gonna just, all that we need from you is how is counseling and psychological services assessing that physical activity is a vital sign question.
Mm-hmm. Okay.
So hopefully that clarifies a little bit for that.
Yes. Okay, that is the last of our questions so far. We can wait for a couple more minutes to see.
If there's, so I think the big takeaways that I'm hoping that you guys got from this presentation is that we've ideally, based on the feedback we got last year and then the changes that we've made, hopefully you find the process to be a lot smoother and easier for your schools to apply so that it's not this large labor intensive thing as far as registering and getting recognition for your campus. We do want you to reapply every year for recognition. But it's not like your old recognition is going to necessarily go away. We do want you to register your program every year, even if you're not applying for recognition, because that helps to provide us the information that we need to not only provide more information to you that you need on how to run an exercises medicine on campus program, different webinar topics and things along that line, but it also allows us to go off to the individuals that we are seeking funding from. And this is the reach that we have with exercises medicine on campus. And these are the types of programs that are being run. And this is why this is so important to support financially.
Yeah, awesome.
So Shelby, from an administrative component, is there anything else you would like them to know to make the process easier?
Yeah, so we tried last year. One piece of feedback that we received was that you can only upload one piece of supporting documentation, and sometimes people don't have the capability to combine all of their documentation into one PDF or Word document, because you can submit a Word document. So we tried to add after each level at a place for you to upload supporting documentation. So hopefully that will help. If you still have problems with that, if you could just email me that documentation, and that my email is on the application, that would help greatly. That was kind of my number one thing last year, is having to track down all the documentation. So hopefully we made the process a little easier this year. But like Renee said in the beginning, if you want to send me any of your feedback, we're looking for ways to make this easier for you so that we can have more and more. You know, we had 139, but if we have 270 plus campuses, we have some room to grow in the 139. So hopefully we have lots more coming up.
Yeah. And I just want to also point out, I know that of all of the advisors and members of the leadership team that I've had the opportunity to chat with, they are doing tons of amazing things on campus, right? They're doing, you know, multiple 5Ks, they're doing health fairs, they're doing all these types of things. We don't need to know everything that your campus is doing. So when you go to upload that documentation, if you would like to put in everything that you're doing, that's fine. But what we really need is a representative sample of what you have been doing. So if you're running 5Ks, you don't need documentation on all of those 5Ks. We just need documentation on one to show that you're doing that health promotion piece of things, and that we can give you bronze level status. So hopefully that makes the documentation piece a little bit easier too. With gold level status, because this is where we tend to have the biggest sets of questions, what we need is not only your referral process, what it looks like, but we need to see documentation that those healthcare providers, wherever they are, whether they're off-campus referrals or their counseling and psychological services or their student health services, what does their physical activity as a vital sign question look like? Where are they located? Is it a screenshot from the EMR? Is it a paper-based system and it's a copy of what you submit? And then what your process looks like. That's what we need. We really need from the gold level stat piece to know that you're implementing the full Exercises Medicine on Campus referral program.
Great. We have a question about the leadership team. Clarissa asked if you could give an example of the credentials required for the advisor.
Go back. So the reality is the fact that we don't necessarily have specific credentials. We need to have a health and fitness professional on the leadership team. Which slot they hold doesn't necessarily matter, and we need a healthcare professional, right? So that's going to be a psychologist, that's going to be a licensed medical professional. But we don't necessarily have a requirement for who the advisor is. If it is run, we do have programs that are run 100% through campus recreation, so the advisor may not be an academic faculty. So we don't necessarily have a hard and fast requirement for that.
Right, just that they would work for the university, or
just that they would work for, yes, just that they must be a member, they must be an employee. I guess employee is the right term of the university.
Right.
And really that should be that is our primary point of contact. When we send things out, that's the person that we're typically sending it out to for information. But as we mentioned, we did have some, as most campuses do, some campuses had turnover, and we were having a hard time getting a hold of some other representatives, and that's why we've asked for all their contact information this year.
I think something else to note, we don't have any questions coming in yet, but something that I think of with recognition, we have a EIM newsletter that goes to all people interested in exercises medicine, or it's got an audience of about 9,000. We'd like to highlight EIM on campus programs, and recognition is a great time for you to kind of tell your story to us at the Global Center. And a lot of times I will pull from the recognition applications when I see a cool story or a cool event or something that you've done on your campus throughout the year. So the application is a great time to tell your story and to tell what you've done and the growth that you've seen on your campus with Exercises Medicine.
And Shelby, I'm gonna plug you, I think, right? If somebody is doing something they think is really unique and they wanted to submit an article to you for inclusion in one of the future newsletters, is that something that we accept?
Yeah, it's something that we're looking for. So you could just send me an email that you think you have a program. I've had some advisors do that already, and we've been able to highlight them. We'll usually have you write like a blog, and I can give you some prompting questions and things that are helpful for our audience to read about. And then we'll highlight you in the newsletter within a blurb, and then link it to that blog is preferable. So yeah, if you're interested or have something worth sharing, we would love to highlight you.
Yeah, Exercises Medicine is Exercises Medicine on Campus is growing in part because of the teams at the various institutions talking about what they're doing, sharing what they're doing with other universities and colleagues. And so we want to help you be able to promote that. So if you are doing something that you feel like is unique, or if you have some really good lessons learned, please share it with Shelby, and let's get that out there to the larger group. If you have questions, if you have things you would like us to do for a webinar as part of our webinar series, email us that as well.
We are getting a lot of questions about receiving the links that you shared, the slides, and the checklist application. All of that will be sent out to participants and all advisors after this webinar. So for those asking, yes, you'll receive the resources that we're sharing.
Okay, so basically they're going to get, everyone who registered for this webinar is going to get a link to the webinar for a replay, is going to get a link to all of the different places to apply for recognition and registration, and as well as a copy of the slide set.
Correct.
There you go, guys. We're not keeping any of this stuff to ourselves. We want to share. If you are not getting, here is one thing, right? I do know that all of you are probably getting hundreds of emails every day through your various institution email addresses. If you are not getting it, the first place obviously to check is your spam account. If you still can't find it after that, make sure that you let Shelby know, and that we don't have don't have your correct contact information.
Mm-hmm.
I doubt that's the case, but you may have to go looking for it. Are there other questions?
Not yet. We've covered them all.
That's awesome. That's what we like to hear. Okay, well, so I think in closing, what I would like to say is thank you guys, all of you, for the hard work that you've done on your campus, for the hard work you've done promoting the Exercises Medicine on Campus initiative, for the way that you've been talking about it, and for applying for registration and recognition, so that we can honor you guys with the work that you do at the national meeting. That is, I don't think we have an exact date, but it's typically Wednesday at about 5:30 is when we do our registration recognition ceremony. Come, get your picture taken. I'd love to personally meet as many of you as I can, find out the great things that you're doing. And then our next webinar is in, help me out, Shelby. Our student representatives are going to be talking, and our next webinar will be
April.
Let's see. We'll be in April. Stay tuned.
April
Check your email.
13th, I believe. April 13th.
Okay, April 13th is when the next webinar will be. And as I said, at that point, you'll have an opportunity to hear from the two students that sit on the Exercises Medicine on Campus Committee. We have one undergraduate student and one graduate student. I will take this opportunity to also plug all of the schools that apply, that are registered. It's registered, correct, Shelby, that have the opportunity to submit a student to sit on our committee?
Yes. One undergrad and one graduate student.
Okay, so as you're pulling together all of this information, I do want to put a plug in for submitting your top student to us. So every school that is registered as an Exercises Medicine on Campus school has the ability to submit a graduate and or undergraduate student to sit on our committee for a year. They sit in on our committee calls, they come to our committee meeting at the national meeting, and they're now starting to give an annual webinar talking about their experiences from a student perspective. This is a great opportunity for a student that who has been doing a lot in Exercises Medicine, is considering going on in their education or doing more with Exercises Medicine. Great opportunity for them to work with the professionals in this area and really be part of how a lot of the behind the scenes work gets done. So I would encourage you to submit your student for that. And that application call will come out separately from registration and recognition, correct, Shelby?
Yes, we'll email advisors with an application.
Okay, but you have to be a registered school to get that email, so keep that in mind.
Mhm.
So any last minute questions?
Not that have come in. No, thank you, Renee.
I think Karina was able to jump on and join us. I don't know if she has any closing thoughts, anything that she wanted to mention.
No, hello everyone. No, I thought that was great. Just to encourage you to register, be part of our global initiative here. We'd love to celebrate all the work that you've done and probably are already doing on your campus, and to be recognized for that.
Thank you. Yes, this you can thank Karina for this. This is this recognition and registration process. It was really a brainchild for a while she was chair of the committee, and I am honored to be able to continue that and really highlight the great things that all the campuses have done. So share with us what you've done. Share it with Shelby. Give us feedback if you have questions. If you have questions afterwards, please do not hesitate to contact us, and please make sure that you get your applications in. They're due, I was erroneous, midnight Pacific Standard Time on February 16th. So you have one more day, but they must be in at that point. We cannot consider applications that come in after that deadline. I am really sorry. So. All right. Thank you guys very much. I look forward to seeing everyone on the next webinar, and I hope that everybody has a great rest of the week.
You as well. Bye now.
Thank you.
Bye.